Raloxifene Hcl is used by women after menopause to prevent and treat bone loss, also known as osteoporosis. It helps to slow down bone loss and keep bones strong, reducing the risk of fractures. In addition, it may also lower the chance of developing invasive breast cancer. However, it is important to note that raloxifene is not a hormone, but it acts like estrogen in some parts of the body, such as the bones, while acting as an estrogen blocker in other parts, like the uterus and breasts. It does not relieve menopause symptoms like hot flashes. This medication should not be used before menopause, and it should not be used to prevent heart disease. The daily dosage and optimal timing for taking Raloxifene Hcl should be determined by a healthcare professional. When taking Raloxifene Hcl, it is important to follow the instructions provided by your doctor or pharmacist. Typically, it is taken orally once a day, with or without food. It's best to take it at the same time each day to ensure you get the most benefit from the medication. Make sure to swallow the tablet whole, without crushing or chewing it, as the drug has a bitter taste. It's also important to ensure that you are getting enough calcium and vitamin D in your diet. You may need to take supplements, so consult your doctor or pharmacist for advice on this. If you are pregnant or may become pregnant, it's important to avoid handling the medication or breathing in any dust from the tablets, as the drug can be absorbed through the skin and lungs and may harm an unborn baby. If you experience hot flashes or leg cramps while taking Raloxifene Hcl, make sure to let your doctor or pharmacist know. It's important to remember that your doctor prescribed this medication because they believe the benefits outweigh the potential side effects. While many people don't experience serious side effects, it's important to seek medical attention immediately if you notice signs of a blood clot or stroke, such as sudden pain or vision changes. Additionally, if you have any symptoms of a serious allergic reaction, seek medical help right away. Remember, this is not a complete list of side effects, so if you notice anything unusual, make sure to contact your doctor or pharmacist. Raloxifene Hcl is a medication that may rarely cause serious blood clots, especially in the legs or lungs. If you have had blood clots in the legs, lungs, or eyes, you should not take raloxifene. Additionally, if you have had a heart attack or are at risk for a heart attack, there may be an increased risk of dying from a stroke while taking raloxifene. Before starting treatment with raloxifene, it's important to tell your doctor about any history of blood clots, stroke, heart disease, high cholesterol, irregular heartbeat, high blood pressure, or if you smoke. It's important to discuss these risks and the benefits of using raloxifene with your doctor. The recommended daily dosage of raloxifene is typically 60 mg, and it is usually taken once a day. It can be taken with or without food, but it's important to take it at the same time every day. Always follow your doctor's instructions for the best timing of taking this medication. Before taking raloxifene, it's important to talk to your doctor about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have a history of blood clots, stroke, heart disease, high cholesterol, irregular heartbeat, high blood pressure, kidney disease, liver disease, heart failure, cancer, or high blood fat levels caused by estrogen treatment. If you have recently had surgery or will be confined to a bed or chair for a long time, it's important to let your doctor know, as these conditions can increase your risk of getting blood clots while taking raloxifene. It's crucial to avoid using raloxifene during pregnancy, as it may harm an unborn baby. If you become pregnant or think you may be pregnant, be sure to tell your doctor right away. It's also important to consult your doctor before breastfeeding, as it is unknown if this drug passes into breast milk. It's important to be aware of any potential interactions with other medications you may be taking. This includes both prescription and over-the-counter drugs, as well as herbal products. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Raloxifene Hcl include bile acid-binding resins, such as cholestyramine, cholestyramine, estrogens, and tibolone. It's also important to note that this medication may interfere with certain lab tests, which could potentially lead to false test results. Make sure to inform any lab personnel and all your doctors that you are using this medication. If you or someone else has taken too much Raloxifene Hcl and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include dizziness and vomiting. It's important to remember not to share this medication with others. While taking Raloxifene Hcl, you may need to undergo lab and medical tests such as bone density tests, X-rays, height measurement, and blood mineral levels. Make sure to keep all medical and lab appointments. In addition to taking this medication, it's important to have regular complete physical exams, including breast and pelvic exams and pap smears. Your doctor may also recommend periodic mammograms. Follow your doctor's instructions for examining your own breasts and report any unusual vaginal bleeding, breast pain, or lumps right away. To promote healthy bones, it's recommended to make lifestyle changes such as increasing weight-bearing exercise, quitting smoking, limiting alcohol intake, and eating well-balanced meals with adequate calcium and vitamin D. Your doctor may also advise you to take calcium and vitamin D supplements, so make sure to consult with them for specific advice. If you forget to take a dose of Raloxifene Hcl, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. Make sure to store Raloxifene Hcl at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When you no longer need it or it's expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember not to flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.